So let's continue for 261. 261, carbonic acid gas is your carbon dioxide. So carbon dioxide is also known as your carbonic acid gas. 262, for patients allergic to penicillins, this drug is used as alternative. It is your letter A, erythromycin. So erythromycin is effective against same organisms as penicillin G, and so it is used in patients allergic to penicillins. 263, these antidiarrheals trap the toxins and flushes them out of your system. Letter A, adsorbents. So adsorbents are chemically inert powders that have the ability to adsorb gases, toxins, and bacteria. So adsorbents are used as antidiarrheals. 264, the drug of choice for urinary tract infection is your trimoxazole or your trimethoprim plus sulfamethoxazole. Trimethoprim plus sulfamethoxazole is your cotrimoxazole. It is the drug of choice for chronic urinary tract infection. 265, Voltaren is diclofenac, particularly diclofenac sodium. Voltaren is diclofenac sodium. The chemical name of pheneticillin is your phenoxyethylpenicillin. So the chemical name of pheneticillin is phenoxyethylpenicillin. 267, the following are the uses of methylene blue, except letter C, antidote for barbiturate poisoning. So your methylene blue is used as an antidote for cyanide and nitrate poisoning. 268, mechanism of action of this antitubercular agent is to inhibit protein synthesis. Letter B. So streptomycin, it is an aminoglycoside used to treat tuberculosis. So its mechanism of action is inhibition of protein synthesis. 269, compounds that result from a combination of electron donors with a metal ion to form a ring structure. Letter A. So your chelates consist of a partial ring of atoms that close up by holding a given atom, usually a metal, in a molecular claw. So that is your chelates. 270, transport of drug molecules from the site of administration to the systematic circulation. That is the definition of your absorption. So absorption, it is the transfer of a drug from its site of administration to the bloodstream. So transport from the site of administration to the systemic circulation. 271, methyl salicylate is also known as your oil of wintergreen. So, methyl salicylate is produced synthetically or is obtained by maceration and distillation with steam from the leaves of Gaultheria procumbens or from the bark of Betula lenta Betula lenta, and Gaultheria procumbens. And the oil is also known as your Gaultheria oil, oil of wintergreen, Betula oil, or sweet birch oil. 272. The agents that facilitate the evacuation of bowels. See your letter B, cathartics. So, cathartics facilitate the evacuation of bowels. 273. Absolute alcohol is commercially prepared by azeotropic distillations. Your dehydrated ethanol is also known as your absolute alcohol. Dehydrated ethanol is also known as your absolute alcohol, and it contains not less than 99% by weight of ethanol. It contains not less than 99% by weight of ethanol. And it is prepared commercially by azeotropic distillation of an ethanol and benzene mixture. So, azeotropic distillation of an ethanol plus benzene will result to dehydrated ethanol, or your absolute alcohol. 274. Nobane is also known as your nalbuphine hydrochloride. Nobane is also known as your nalbuphine hydrochloride. Letter B. 275. Cowpectate is the combination of kaolin plus pectin. So, medicinally, your cowpectate is used as an adsorbent in the treatment of diarrhea caused by agents capable of being adsorbed. So, example, diarrhea of food poisoning. So, your cowpectate is medicinally used as an adsorbent for the treatment of diarrhea, primarily caused by food poisoning or agents capable of being adsorbed. 276. The least stable of all vitamins is your ascorbic acid. So, it is stable in the dry state but is easily oxidized in aqueous solution in the presence of air. So, what will be your remedy for ascorbic acid? You have to avoid moisture, or you have to close tightly the container, or minsan nilalagyan nila ng cotton or even the tawag dun? So, na tayo, nilalagyan nila ng desiccant or yung silica gel to prevent moisture. So, again, your ascorbic acid or your vitamin C is the least stable of all vitamins. 277. A change in structure of isoniazid causes decrease in the potency of the drug. So, a change in structure of isoniazid causes decreased potency of the drug, which will result to less effectivity of the drug. 278. The most toxic vitamin is your retinoic acid. Retinoic acid or your tretinoin is believed to exert its anti-neoplastic effect by promoting cellular differentiation toward normal cells. Your retinoic or your tretinoin is the most toxic vitamins. Kung si vitamin C ay least stable of all vitamins, si retinoic naman, it is the most toxic vitamin. 279, major organ for excretion is your kidney. How about metabolism? Metabolism. So the major organ for excretion is your kidney. The major organ for metabolism is your liver. Your small intestines naman and the rest of the part of the stomach, such as your large intestine and your esophagus, they are the organs for digestion. 280, generic name of Benadryl AH is diphenhydramine. So the generic name of Benadryl AH is diphenhydramine. 281, a bright red dye that was found to create remarkable cures for streptococcal infection is your Prontosil. Prontosil it is also found that it caused remarkable cures of streptococcal infection of mice. 282, halazone is a chlorine-containing anti-infective. So its sodium salt is used to disinfect drinking water. Halazone is a chlorine-containing anti-infective. Its sodium salt is used to disinfect drinking water. Drug of choice for leprosy is your dapsone. So dapsone is used in the treatment of both lepromatous and tuberculoid types of leprosy. So it is the drug of choice for both lepromatous and tuberculoid types of leprosy. Dapsone. 284, the metabolic function of niacin is reduction oxidation reaction, or your redox. 285, the sunshine vitamin is your vitamin D because it is formed by the action of the sun's ultraviolet rays on precursor sterols in the skin. So vitamin D is known as your sunshine vitamin. 286, the following are fat-soluble vitamins except your B2. So your ADEC are your fat-soluble vitamins. Your B2 is a water-soluble vitamin. ADEC, fat-soluble vitamins. In terms of pH, 287, aspirin is absorbed in the stomach. So, since aspirin is acidic, the relatively low pH of the stomach favors the absorption of aspirin because at low pH, aspirin is in its unionized, or it is more absorbable in its form. Ayan. 288, therapeutic gas used as a gas diluent or carrier is your helium. So helium, because of its low density compared to nitrogen, it is used to prepare gaseous mixture composed of 20% oxygen and helium. And this is used to alleviate respiration difficulty. So your helium is the second lightest element. Also, it is also known as your artificial air. Second lightest element, and also known as your artificial air, and it is used to alleviate respiration difficulty. 289. The following drugs are extensively metabolized in the liver except paracetamol. So your isoproterenol, propranolol, and your lidocaine are extensively metabolized in the liver. 290. A dye used in vital nerve staining is your methylene blue. Methylene blue. 291. The excretion of weakly basic drug will be more rapid in acidic urine than in basic urine because the drug will exist primarily in the ionized form, which cannot be easily reabsorbed. 292. Superinfection is common with those which suppress the normal bacterial flora. Superinfection is common with those which suppress the normal bacterial flora. 293. A potentially fatal aplastic anemia is a toxicity associated with chloramphenicol. So your hemolytic anemia occurs in patients with low levels of G6PD. So that is your aplastic anemia is a side effect of your chloramphenicol. 294, which is not true for cephalosporins. It is affected by penicillinase. So your cephalosporins are broad spectrum, bactericidal, and is acid stable. 295. Bactrim and Septrim are trade names for a fixed dose combination of your sulfamethoxazole and trimethoprim. So your Bactrim and Septrims are trade name for your cotrimoxazole. 296. Which of the following is most likely to cause tinnitus and hearing loss in higher doses? Is your acetyl salicylic acid or your aspirin? So side effects of aspirin at higher doses: tinnitus and hearing loss. 297. Pharmacologic effects of classic antihistamines include all of the following except inhibition of gastric acid secretion. That is the pharmacologic effect of your H2 receptor antagonist, inhibition of gastric acid secretion. So the rest are side effects, pharmacologic effect of your antihistamines, sedation with low doses, antipruritic effect, drying of saliva, and bronchial secretion. 298. An example of a commercial product that is prodrug is your Lasix. 299. All of the following statements are correct except your ketoconazole penetrates into the cerebrospinal fluid. Take note, your ketoconazole does not enter the CNS. Ketoconazole does not enter the CNS. And last, large overdose of acetaminophen are likely to cause hepatic necrosis. Large overdose of your acetaminophen is likely to cause hepatic necrosis. So that is the last part of your organic chemistry. So you have to familiarize all the questions and the answers. Okay, our next module would be Module 2, which composed of your pharmacognosy and your biochemistry.